Hello and welcome. Today, we'll be diving into urethral sphincter dysfunction, a condition that affects bladder control. We'll explore what it is, what causes it, how it's diagnosed, and the available treatment options.
Let's get started!
So, what leads to urethral sphincter dysfunction? There are several potential causes. Nerve damage, often stemming from spinal cord injuries, stroke, or conditions like multiple sclerosis, can disrupt the communication between the brain and the sphincter muscles. In women, childbirth or pelvic surgery can weaken the sphincter. In men, prostate surgery is a common culprit. Other contributing factors include aging, certain medications, and even congenital abnormalities. To understand the problem, we need to look at the pathophysiology. The urethral sphincter, a ring of muscle surrounding the urethra, plays a crucial role in urinary continence. Normally, it contracts to keep urine in the bladder and relaxes to allow urination. In urethral sphincter dysfunction, this control is impaired. The sphincter may be too weak to prevent leakage, or it may fail to relax properly, leading to difficulty urinating. This disruption can result in various bladder control issues. Pinpointing the exact epidemiology of urethral sphincter dysfunction is challenging because it often overlaps with other urinary conditions. However, we know that it becomes more prevalent with age. Women are generally more affected than men, particularly after childbirth. The incidence also increases in individuals with neurological disorders and those who have undergone pelvic surgeries. The signs and symptoms of urethral sphincter dysfunction can vary depending on the severity and underlying cause. Common symptoms include urinary incontinence, ranging from occasional leaks to complete loss of bladder control. Urgency, the sudden and compelling need to urinate, is another frequent complaint. Some individuals experience frequent urination, both during the day and night. Conversely, others may struggle with urinary retention, having difficulty emptying the bladder completely. The symptom profile is quite variable and can significantly impact quality of life. Diagnosing urethral sphincter dysfunction typically involves a thorough evaluation by a healthcare professional. This includes a detailed medical history, physical examination, and various diagnostic tests. Urodynamic testing, which assesses bladder and sphincter function, is often performed. Cystoscopy, a procedure where a small camera is inserted into the bladder, can visualize the urethra and bladder lining. Imaging studies, such as ultrasound or MRI, may be used to evaluate the anatomy and rule out other conditions. A post-void residual PVR measurement will show how much urine remains in your bladder after voiding. While there aren't strict classifications in the same way as some diseases, we can categorize urethral sphincter dysfunction based on the primary issue. One way is to differentiate between sphincter weakness, leading to stress incontinence, and sphincter overactivity, leading to urgency incontinence or difficulty voiding. Another method is to classify it according to the underlying cause, such as neurogenic, traumatic, or idiopathic. Understanding the specific problem is critical for tailoring the right treatment plan. Treatment for urethral sphincter dysfunction is multifaceted and aims to improve bladder control and quality of life. Conservative measures often include pelvic floor exercises, also known as Kegel exercises, to strengthen the sphincter muscles. Lifestyle modifications, such as timed voiding and fluid management, can also be helpful. Medications, such as alpha blockers or anticholinergics, may be prescribed to improve bladder control. For more severe cases, surgical interventions, such as slings or artificial sphincters, may be considered to provide mechanical support to the urethra. Botulinum toxin injections can be utilized for sphincter overactivity. While not all causes of urethral sphincter dysfunction are preventable, there are steps you can take to minimize your risk. Maintaining a healthy weight, practicing regular pelvic floor exercises, and avoiding smoking can all contribute to bladder health. For women, proper care during pregnancy and childbirth can help prevent pelvic floor damage. Managing underlying conditions, such as diabetes and neurological disorders, is also important. Regular check-ups with your healthcare provider can help detect and address any potential issues early on. The prognosis for urethral sphincter dysfunction varies depending on the underlying cause and the effectiveness of treatment. Many individuals experience significant improvement with conservative measures and lifestyle modifications. Surgical interventions can often provide long-term relief. Recent research focuses on developing less invasive treatments and improving the efficacy of existing therapies. For example, stem cell therapy and gene therapy are being explored as potential future treatments. The field is constantly evolving, offering hope for even better outcomes in the future.